Hello everyone. So in this video we are going to talk about a refractive error, that is presbyopia, and by definition it is a progressive failing of near vision also termed as punctum proximum, that is because of age related physiological insufficiency of accommodation. So understanding these 5 points makes the whole story of presbyopia very easy, that it is progressive and senile physiological because of insufficiency of accommodation that leads to recession or failing of the near vision. So let's try to understand what actually happens. So a parallel rays of light coming from infinity are focused over our retina in a normal case, whereas a divergent rays of light that comes from a near object that reflects divergent rays, if the eye remains in same configuration as for a far object, these rays will converge behind the retina. Okay, because these are divergent rays, but this actually does not happen because of a proper accommodation, that the near object divergent rays through accommodation result in the focusing of these rays over the retina. Now, during accommodation, our ciliary muscle contract, leading to decrease in the diameter of ciliary ring, and zonules relax, leading to increased curvature of lens that increases the power of lens, resulting in converging of rays earlier, that is into the retina. So this is what occurs in accommodation, but with age there is decrease in insufficiency of accommodation, and this result in the recession or going far of our near point. Okay, so let's try to understand how generally patients present. So before the age of 40 years, the physiological insufficiency of accommodation result in a near point that is around 25 centimeter, and this is actually the distance at which we generally read things. So a patient less than 40 years, if having a physiological insufficiency of accommodation, will have no difficulty in reading things. But as the age goes above 45, the near point shifts to 33 centimeter because of because of insufficiency of accommodation. Now this is not normal distance of reading, and this is why this age group of 40 above 40 generally presents with complaint where they are not able to read the nearby things, means newspaper and books. Understanding the causes of this presbyopia. So this presbyopia where there is insufficiency of accommodation, and we already studied the role of different parts of eye in the role of accommodation. So this is a schematic diagram. So if this is cornea, iris, the ciliary body, and lens. So generally the causes are age related, that is with age the lens capsule loses its elasticity, so while the ciliary muscle contracts there is no proper change in curvature of our lens. Similarly, in the case of nuclear sclerosis leading to hardening of the lens, the same thing happens. Other thing is our ciliary muscle itself get weakened. So these are the causes for age, these are the causes that actually lead to physiological insufficiency in our presbyopia. Now there are cases where we have premature onset of presbyopia that are because of premature nuclear sclerosis or cataract, say. Okay, so let's try to understand the symptoms. Since there is a recession of our near point, the patient will have near vision defect. Okay, the patient generally complains of not able to read books at usual distance. Okay, newspapers. The other thing is asthenopic symptoms. While patient tries to read at the same distance or try to accommodate, the patient generally have pain over the eye, the headache. In general term, asthenopic symptoms are termed eye strain. Okay, that is a common term used for it. The other thing is intermittent diplopia. So now if we go into details of accommodation, accommodation is a part of near reflex. That is, the accommodation reflex also involves the convergent reflex and the meiosis of the pupil, that these three altogether include the near reflex. So there is discoordination between our convergent reflex and accommodation reflex, and that leads to intermittent diplopia. This is a rare symptom seen in the case of presbyopia. Most of them presents with a near vision defect. Now in treatment we use optical treatment, that is presbyopic glasses. Now these can be unifocal, means one with only the convex power. Okay, so in these patients we are going to use a convex lens. What convex lens will do is the divergent rays will get converged faster, because convex lens is a convergent lens. Okay, so by increasing the power of the medium through which the light passes, the divergent rays are converged before they reach behind the retina, and hence gives a proper vision. So we use presbyopic glasses that are convex, and these can be unifocal or progress or multifocal. Multifocal in case we have a convex glass for near vision, and a concave if the patient also has defect in far vision. So another one is if patient does not tolerate these glasses, we use progressive lenses where the power changes as we see in the lens. Okay, the other treatment are surgical, and they are also good. We also need to remember one more feature, that we need to differentiate this condition presbyopia from a condition that is insufficiency of accommodation. Now insufficiency of accommodation is in this condition also we have insufficiency of accommodation. Okay, sorry. So insufficiency of accommodation is a condition where we have loss of accommodative power, similar to the case of presbyopia, but in this case the loss of power of accommodation is not in uh, so here loss of accommodative power is not physiological, similar to presbyopia. Here we have pathological diminution of accommodative power compared to the age at which it is occurring. Okay, so this is generally a result of primary open angle glaucoma that is causing ciliary muscle weakness, or a systemic disease like patient has toxemia or debilitating condition that are causing the ciliary muscle weakness and leading to this condition. Okay, so this is what we needed to remember about presbyopia. Thanks for watching.